Okay, so today on this uh, PowerPoint, we're going to talk about Chapter 5, which looks at stress and how our bodies maintain balance when life gets too stressful. So basically, your life in a nutshell as a nursing student. Here are your objectives that you should be able to talk about or discuss by the end of this PowerPoint. So we talked about homeostasis kind of throughout the entire class so far, but homeostasis is our body's way of keeping everything steady, mellow, kind of like a thermostat keeping the house comfy. So all the way from our temperature to our pH balance to our endocrine system, homeostasis is our body's way of making micro adjustments. Now remember, these are done through feedback loops. So there's negative feedback loops. This is kind of that feedback loop we talked about with our endocrine system and our thyroid, and positive feedback loops. So things like a mother's milk supply. If we have positive feedback loops, the baby drinks the milk, it positively encourages the body to make more milk. Okay, so that's kind of our feedback loops. These are kind of like our body's text alerts to fix problems quickly. Stress is any physical, emotional, or environmental factor that messes up our homeostatic balance. So, our body's ability to adapt and overcome and maintain homeostasis determines our health outcomes. When we are thrown out of our homeostatic balance, our body's ability to adapt decreases and we have disease process occur. Eustress is positive stress, so that can actually motivate and enhance our performance. So that would be something like stress in a volleyball game. You know, maybe we're not doing as well, we're a little bit stressed, we're getting frustrated, and that can actually motivate us to enhance our performance or change what we're doing. De-stress or distress is a negative stress that can overwhelm our body's mechanism that regulates homeostasis. So, some distress could be like our respiratory system with our patient who has DKA. They have a distress by that respiratory system being increased, right? Our Kussmaul respiration. And so this changes our regulatory mechanism. We start to buffer and we start to change our oxygenation in relation to our respiratory status for our CO2 buildup. Adaptation is a continuous process that our body does that requires interaction of all of our systems to occur. So our neurological system, our endocrine system, and our immune system all work together and interact to keep our body regulated. Allostasis describes how the body achieves that stability throughout change. This often requires an activation of our stress response pathway, and we'll talk a little bit about that on the next slide. Okay, so we're going to talk about the general adaptation syndrome related to stress and how our body adapts to stages of stress and how we can decrease that. So we have three stages for the general adaptation syndrome to be aware of. First stage is the alarm stage. Second stage is resistance stage, and third stage is exhaustion stage. Now we're going to kind of talk about this model or this syndrome in relation to if we saw a bear while we were out hiking. So the first stage, let's say we're out walking, it's a beautiful day, we're out, you know, looking at these flowers and being one with nature because we're so stressed out about nursing school that we need to go out and, you know, bring ourselves back to reality here. But we all of a sudden see a bear, right? And so that stimulus of our seeing a bear hits our brain and our body says, oh no, a bear, right? So our body kicks into action. So it triggers our fight or flight response system. This is a sympathetic nervous system and adrenal medulla system. So both of those enact. We talked about this briefly in our endocrine system with our nervous system and our endocrine system working together in lightning speed, right? To get some of these hormones going to help us. So this kicks in the moment we see that bear. Now, physiologically, what's occurring is that the adrenal glands release epinephrine and norepinephrine. This causes our heart rate and our blood pressure and our breathing to shoot up. This lets our body start having more blood flow to our most vital organs, and it helps our breathing increase so that we have more energy that's going into our bloodstream. So our glucose floods into our bloodstream and gives us quick energy. Our pupils dilate to help us with seeing more effectively and being more keenly aware of our surroundings. Our digestion actually slows down because we don't need to worry about digesting our lunch when a bear is coming after us. So digestion and unnecessary metabolic things, they slow down and decrease. So all of our body energy can go towards our fight or flight response system. So we can either fight the bear and punch him in the face, or we can run away. Our body's fight or flight response really gives us a burst of energy so that we can run or climb a tree or get away. So then we enter into the resistance stage. So if that bear doesn't immediately leave, let's say we have that stress or that trigger that's still there for long periods of time, our body will try to adapt and cope with that stress, so that long-term stress. The physiological pathway that occurs is our HPA axis. Remember, we talked about that in endocrine. That HPA axis takes over, and cortisol and other stress hormones remain in our blood to help keep our blood glucose level up and inflammation process activated or inactive. So our body stays on high alert, but it still tries to conserve resources so that we can keep running or hiding. So it maintains the stress response while we figure out how to get out of our danger. Okay, so we're still in that prolonged stress, but our body's fight or flight system has changed to a adapt and overcome or adapt and cope system. Then if that stress keeps going, so like let's say we've been with that bear and he's down at the bottom of the tree for multiple days, we eventually hit the exhaustion stage. Our body's not able to keep up the level of reserves. So our body's reserves start to run out. Our cortisol level stays high, but our immune function starts to drop. And so this is where we become more vulnerable to illness or injury. Now, our bodies get really freaking exhausted, they get tired. So we start to see things like fatigue and anxiety and physical breakdown. Okay. So this is where chronic stress or that prolonged stress can lead to long-term health problems like hypertension, impaired immunity, infection, and things like that from a prolonged cortisol level that's high and our immune function dropping. Okay. So our 3 stages are alarm stage. This is where we see that stimulus, that trigger, that bear. It kicks in our fight or flight response. All of our body systems increase, like our blood pressure, our heart rate, everything's elevated. Then we move into the resistance stage. That stressor is chronic. It's not going anywhere. We're still with the bear for long periods of time, and our body starts to uh, conserve resources and stay on high alert. Okay, so our cortisol level keeps elevating and stays at a high level. Our stress hormones stay at a high level, and so this really starts to break down our body in a subtle way. Then we have our exhaustion stage. This is where those cortisol levels have been elevated for long periods of time. That bear is still down at the bottom of the tree days later. Now we're starting to get weak and fatigued and we're physically breaking down. Okay. So acute stress, like seeing a bear, that initial stress can be normal and productive. It can be fine. We can have those, those metabolism effects occur. We can have a high heart rate, we can have high blood pressure for a short period of time. But when it's chronic, when we see bears all the time, or we're stressed out from nursing school constantly all the time, then we can have an increase of cortisol, an increase of stress, decrease of our immune system, and this contributes to disease. Things like hypertension, increased infection, and things like that. Okay. So remember the 3 stages and kind of be able to explain what happens in the body, what patient cues you would be seeing with general adaptation syndrome. With our chronic stress, it can lead to continuous release of those stress hormones, can lead to damage with tissue and organs. It increases risk for hypertension, diabetes, obesity, GI issues, depression, anxiety. So we really want to make sure that we decrease chronic stress exposure as much as possible and make sure that we're assessing for signs and symptoms of this maladaptation that a patient might have. So nurses play a crucial role in assessing stress and adaptation. We want to make sure we do a good intake assessment, ask the patient what stressors they have, gather a good, thorough health history, evaluating their coping mechanisms, how they cope with stress, and take into account any family or cultural, social context. So, do they have any family stressors or cultural stressors that maybe are being imposed on them? Some physical cues that we would see in our patients for stress would be changes in their vital signs. So remember, in relation to the general adaptation syndrome, we might have an increase in blood pressure, heart rate, respirations. We may have changes in sleep pattern, changes in their appetite. So if they're not eating enough or they're eating infrequently, maybe they're not sleeping at night or they're having trouble sleeping. They may have decreased immune function. So if we're seeing signs and symptoms of infection or changes in their WBCs, those lab levels, that may indicate some level of stress. So really gathering information and doing a really good assessment on your patient will help you identify what stressors they have and how they cope with those stressors. So, some evidence based interventions that help reduce stress can include relaxation techniques like deep breathing and guided imagery, progressive muscle relaxation. This is where you'll have your patient close their eyes, make sure that they focus on their breathing, and they kind of talk themselves through relaxing muscles progressively at a time. So, you can have them close their eyes and say, imagine yourself relaxing all the muscles in your feet. Now you feel the muscles in your legs relax. Now you feel the muscles in your upper thighs relax. And so they progressively relax each set of muscles until they decrease tension and kind of contraction in their muscles. Increasing physical activity. Individuals should be told to exercise a minimum of 30 minutes every day for their mental well being and to reduce stress. They can do mindfulness moments, and I put a video at the end of this lecture for that. So take a peek at that. It kind of goes over progressive muscle relaxation and guided imagery, but it helps with a mindfulness moment. This is where a patient or an individual can center themselves and really just be in the moment and focus on what's going on around them. And then cognitive behavioral strategies. This is tying what people are going through. So stressors tied with their behaviors in relation to that. So, cognitive behavioral strategies. Counseling, therapy, and social support are crucial. So, if an individual has chronic stress or severe stress, maybe they had a death of a loved one, we want to get them in touch with a support group or a therapist or a counselor. Mental health is so important with stress management. So, other things we can do, we can have them help with healthy coping mechanisms. So those I have put some on the screen here on this slide. So maybe they like to socialize for a little bit, go out to dinner with friends every once in a while. Maybe they like to meditate or attend church. They can do yoga or Tai Chi, acupuncture. Again, exercising 30 minutes every day, reading a book for pleasure, or doing something that they like to do. Really just doing things that decrease their stress. And you, as a nursing student, should also try to incorporate this. I know you guys don't really have like a whole lot of time, but while you're studying, maybe study for 30 minutes and then go do a mindfulness moment for 5 minutes, or go study for an hour and then go on a walk around the block for 10 minutes, 15 minutes, just to really keep that your mind open and keep your stress down. Okay. So this is what we can educate on for our patients. Educating and identifying healthy coping mechanisms and referring a patient to mental health services when appropriate is basically your interventions for stress management for your patients.